Okay, so this is shoulder abduction now, and then return from abduction or adduction. There's a lot of similarities that we're going to see with the scapula. So with flexion and extension, there's some pieces I didn't talk much about, but I'll hit here, such as scapular winging, or even the inferior angle coming off. So anytime a patient is moving into flexion or abduction in this case, if their scapula wing, right, so go ahead and come back down for me, if their medial border of the scapula pulls away from the thorax, that's what we call scapular winging, and we're thinking that the serratus anterior is not doing its job. So it's long or weak, could be a nerve injury as well, which is causing that winging to occur, okay? If it's just the inferior angle that's winging, we're thinking that the pec minor is having a big pull on the scapula, causing the inferior angle to come out towards you. So a better angle here, if I have them face here. An anterior tilt, you can see if this is the inferior angle, an anterior tilt is going to pull out just at the inferior angle. That could be due to pec minor tightness or shortness, and then deficiency of the lower trap. The lower trap is going to help depress the scapula and hold it against the thorax at the inferior angle. Okay? So let's have you face this way. We're going to just watch how Sam moves into abduction and then back into adduction. Same glenohumeral rhythm. We want 60 degrees of scapular motion. And again, we should be looking at that mid-axillary line. And then we should have about 180 degrees of glenohumeral motion. So go ahead and do that a couple times, Sam. And then I'm looking at the quality of his motion. Are his scapula upwardly rotating? Are they controlled coming back down? So let's say Sam's up here, and let's say he gets to this point and his shoulder blade just gives. Everything just lets go. And you're going to see that on classmates. So when he abducts, this all looks good, but his eccentric control now of the serratus anterior could be impaired, right? So if he can't control it, it's just going to rush into downward rotation. So that could be a reason why it's going so fast into downward rotation. Another reason could be we have our scapular thoracic muscles, right? We think of our rhomboids, we think of our upper traps, we think of our lower traps, we think of our serratus anterior, and then we have our scapulohumeral muscles. Think like rotator cuff, deltoids. So when he's coming down, there's going to be a certain point where gravity, if these don't lengthen appropriately, they stay short, and these lengthen too quickly. When the scapulothoracic muscles lengthen too quickly, these don't lengthen, it's going to cause a quick translation into downward rotation. So there's two reasons we're looking at this. One, poor eccentric control of serratus anterior, and then two, could be short scapulohumeral muscles, which kind of force the scapula into a downward rotation quickly. So when Sam does this, he looks good, so it's kind of hard to see. But what I mean is as he abducts, I'll have you abduct, should upwardly rotate. On the return, you might see, go ahead and come down, you might just see a quick drop into downward rotation. And that's the scapulohumeral muscles potentially being short and poor eccentric control of the serratus anterior. Okay? So that's ab and adduction. So a couple things I wanted to talk about was the winging of the scapula, which you can see with shoulder flexion and extension. Okay? I mean, not on Sam, but you might see winging. And then you might see the inferior angle pop up too. When the inferior angle pops up, we should be thinking short or stiff pec minor potentially, and then poor recruitment of that lower trap to hold it down and depress the shoulder blade. So those are just some things that I'm looking at when we ab and adduct. And then if I have you face the whiteboard for me, I'm going to have him ab and adduct again. And as he does that, again, we're looking at the mid-axillary line. And as he drops down, does he have a smooth recruitment back down? Okay? So that's what I'm looking for ab and adduction and flexion and extension. And then just making sure that it's symmetrical. So let's face this way. And then let's have you do it one more time. So you can see Sam does a pretty nice job there on the way down. You can see that they're not symmetrical. One's coming a little quicker than the other. One more time for me, Sam. So coming up. And then as you come back down, I told him that, and he corrected it. So if I can say something and Sam corrects it, that's a recruitment problem. He just needed a verbal cue to correct it. So I'm not too worried about that. However, one might drop quicker than the other, and you got to figure out why that is based off of what I just talked about.